Recognizing the early signs of disease can help protect your plants before the infection becomes severe. This condition is often associated with Pectobacterium carotovorum, a soil-associated bacterium that causes destructive soft rot symptoms in plant tissues. One of the earliest signs appears in newly planted root shoots. The internal tissues of the stem sheath and roots begin to decay, developing dark brown or yellow, water-soaked areas. A particularly noticeable warning sign is the unpleasant foul odor produced by the rotting tissue. When an infected leaf sheath is cut open, pale yellow to reddish fluid may ooze from the damaged tissues. As the infection progresses, the affected leaf sheath breaks down, causing the leaves to suddenly lose their vitality and eventually dry out completely. In more advanced cases, the base of the stem may become swollen, blistered, and cracked. Older plants can also develop rot in the leaf sheaths and petioles. If a severely infected plant is pulled from the soil, the stem may break at the diseased leaf sheath, while the bulb and roots remain in the ground. The disease commonly becomes noticeable around 3 to 5 months after planting, although the timing can vary depending on environmental conditions and crop development. The disease is caused by Pectobacterium carotovorum, which can survive in moist soil and infected crop residues. The bacteria can spread from plant to plant through rainwater, irrigation water, and contact with infected leaves or branches. Young plants are often particularly vulnerable. The pathogen can enter through natural openings or wounds caused by cultivation, insects, or other mechanical damage. Once inside the plant, the bacteria break down internal tissues and interfere with the plant's ability to transport water and nutrients. Warm, humid weather and frequent rainfall create especially favorable conditions for bacterial growth and disease development. Severe outbreaks are more likely during hot and humid periods, and the economic impact can be particularly serious when plants are approaching important reproductive or fruit-producing stages. At present, there are limited reliable biological options for curing plants that are already infected. Once severe symptoms appear, removing affected plants and preventing further spread is generally more practical than attempting to restore diseased tissue. For long-term prevention, strict sanitation and good field management are essential. Use healthy planting material from reliable sources and avoid introducing plants from fields with a history of the disease. Give plants adequate spacing to improve air circulation and maintain good drainage to prevent waterlogged soil. Use only well-composted organic matter and regularly inspect the field for early signs of infection. Disinfect tools and equipment after working with diseased plants. Crop rotation with non-host or less susceptible crops for at least 3 years can also help reduce bacterial populations in the soil. Handle plants carefully during cultivation and avoid unnecessary mechanical injuries, especially around the roots and lower stems. Avoid working in the field or applying fertilizer when foliage is wet, as wet conditions can encourage the movement of bacteria between plants. Whenever possible, harvest during dry weather. If infected plants are identified, remove them carefully and dispose of them according to local agricultural and environmental regulations. Do not leave infected plant material in the field, where it can become a continuing source of bacteria. The key symptoms to remember are soft, water-soaked brown or yellow internal tissues, a foul odor, rotting leaf sheaths, and sudden loss of plant vitality. In advanced cases, the stem base may blister and crack, followed by drying and collapse of the leaves. Early detection, good drainage, sanitation, and careful handling are among the most important steps for reducing the risk of this destructive bacterial disease. Follow the channel for more practical tips on keeping your plants healthy.